Very good evening, my beloved colleagues, for today. Today we are sitting here for a very important issue, especially for the Osce aspirant, those who are appearing the exam or will appear in the next diet as well. And we name that session today is the new tricks. I think most of you know about the Osce exam in the meantime, those who are MRCGP aspirant. But what are the new tricks? The latest development and latest collection usually we got after one Osce diet is over. Then we try to analyze after getting the comments or feedback from the examination related persons. So we like to share to you, and today is the session. I hope you will have some new technical aspect of your Osce preparation. And let's go now with my humble introduction as before, and the institute as well, welcoming you with the moral alert. So today's topic is new tricks for the Osce preparation. And I believe that you will remain with us until the end of the session. And very usually, whenever you need any query, question, you will open the mic. Better to raise the hand to attract our attention. Then you will ask or discuss. Just for very new colleagues, this is the picture of Osce station. Single station, examiner, then the candidate and the surrogate. This gentleman, and the face is not actually visible. This is a surrogate. This is the bed and other thing, chair and table. And this is the picture of the outside. You will be waiting in one station, one by one. And if you look at the dress up, you might be confused. How will be good dress up in the exam? Today we will not discuss it, just to give you the touch. Already we discussed before in our YouTube and other links also. Those who are using the module, they know about the dress up. Anyway, so just to draw your kind attention, we have shown the picture. And first of all, I like to inform you what are the type of case instruction there. You may not get this message directly from anywhere. This is our observation and analysis. Usually, after giving a scenario, Mr. or Mrs. such and such waiting to talk to you, then what will be your task? In your task, the commonest task is consult the patient, examine, that means the clinical examine, and make a management plan. Most of the systemic cases like this. Another instruction is consult and manage. So you can understand that the examination is not mentioned. My beloved colleagues, just be careful. I will ask you again little later. Third instruction, consult, no examination needed, and management. That means manage, make a management plan. I have given some example of system-wise category of the cases, in which instruction usually which type of cases are selected. Now, who can say me about if any advanced candidate here, the difference between second instruction and the third instruction? What will be the difference in the tasking? Please, anyone, what do you understand? Open the mic, please. Or you have
Sir,
gone through
yes,
one? Yeah, Dr.
in
Aslam.
case of second consult and management means there might be some need to examine. You can, if the requirement of management. And in
Yes,
second, no examination means you don't waste your time in examination.
definitely no waste time. And if you do examination, it is your mistake. Okay, Dr. Aslam. But
Yes, sir.
in
Yes.
the second one, if I start from the beginning, in the first one, you must examine the patient. That is a consult, examine, and management. In the second one, you may need examination. Our suggestion is plan for examinations. We tell it the focused clinical examination. But usually in that way, you don't need to do examination manually, but you utter, or it is called the verbalize your examination plan. Surrogate or examiner will tell you the findings, and most of the time they will tell you nothing wrong, no abnormality. But interestingly, somewhere, especially for the private part examination, Dr. Aslam, where are you? Please be connected. I feel better to see you
Yes, sir.
alive,
Yes.
active.
Yes.
Yes, sir. The, for example, when you need examination of the parectal examination, you are suspecting case the enlarged prostate. So examination is very important in our clinical practice, but it will not be allowed in the examination hall. At that time, your instruction was consult and manage. So what you will do? You will tell that I like to examine the back passage. That means I will tell to the patient, may I examine your back passage, please? Then surrogate will tell you, or examiner also will tell you the finding. Or surrogate could ask, doctor, what you like to see there? Understand? Then you
Yes,
will
sir.
tell that I will do it, do it, do it. This is a little difference from the from the third instruction or the first instruction. Okay. And you understood that OB-GYN case usually female reproductive organs, internal organs. So you understand that examination not needed there. So these are an overview for the type of instruction. And very interesting thing is the checklist for the examiner, that is mark sheet. And those who are preparing already on the way, you must be oriented with this checklist because your markings will be given according to this one. And this is actually main agenda of today's discussion. The examiner is to write some positive information, what you have done, and some negative information, what you have done, according to the skill. And after this, the net outcome will be marked here. And nowadays, examiner is to write, not by check mark. This is not your matter, this is their matter. Previously, it was written, but in the last exam happened. Examiner were to write by pen or pencil there, excellent, competent like this, not by check mark. Might be that the examiner could be less attentive or wrongly given check mark, or by giving the check mark, there might be confusion. For this reason, the arrangement is as such. So if above this baseline, if you get the score, then you will be able to pass more likely. So there are 4 skills are there. You need to develop this thing, 4 skills to pass the exam, and I will enlarge it for you now and highlight some words for you. So in the 1, requires candidate to demonstrate communication and consultation skill. So we discussed it before also. Those who are old participant from before, they know about it, but those who are new, this discussion mainly for you. And regarding the consultation skill, we have our video discussion more than 1 hour. We will get it easily in the YouTube. What are the consultation skills? That is, it is not the content of your case, diagnostic case or other issue. What is the style of talking? There are some rules. Usually 23 rules are there, offered by the Royal College of General Practitioners, UK. Second one is the data gathering, means history taking. Third one is, there are 2. One is the examination, another is the counseling skill according to the case instruction. Already you have seen that in the previous case instruction, somewhere examination is not needed. In this case, you need to talk more, and some station mainly focusing the counseling. Remember, every case needs counseling, more or less. But some case is counseling focused. Remember, and I will summarize later on after today's, at the end of the today's discussion, how to summarize the category of the cases. After the discussion, you will get it. And the 4th is the management. And be tricky here. Our traditional learning in our undergraduate, even in our postgraduate, in some countries, in South Asians also, we were thinking after the investigation, we will write the management plan. I think, may I talk to Dr. Shoaib bhai, please? In our traditional learning in the country, in undergrad also, and we have checked our long case paper in the exam,
Yes.
our
Yes.
students, what they are writing, history, examination,
Right.
then salient feature maybe like this, and then investigation, then management.
Yeah.
Actually,
Yes.
this is
Yes.
the wrong way. This is the wrong
Mm-hmm.
way.
Mm-hmm.
Because investigation is a matter of planning,
Part of
and
management.
practically it is a matter of management.
Right.
So Royal College of General Practitioner actually marvelously addressed this.
Mm-hmm.
For this reason, they included the investigation under the headline of management.
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 Right. Right.
Thank you very much, Dr. Shoaib bhai.
Yeah. Welcome.
And there are some highlighted points you already understood, and we need to know it according to the skill. Skill wise, you need to sharpen your understanding. Okay. And after these four, you are seeing that there is an overall assessment by the examiner. This is a flagship area. Overall, what examiner is thinking about your exam, they will give you scoring. There are also four scoring. Okay. Poor, unsatisfactory, competent, and excellent. So if we score there one, minimum one, maximum four for each scale, there will be marking of 20. Okay. And in the 20, how much you are acquiring, you will check. Your friend will observe, your mentor will observe in your process of practice. Then you will feel confident that you are ready or not. Any query about the mark sheet, please? Any colleague? You can open the mic. Is
Oh, it's
there a
okay.
comment? Is okay?
It's
Thank you.
okay.
Thank you
Yeah.
very much. Thank you very much. So now come to the second skill. Actually, first skill, I don't need to show you. This is 23 skill already we discussed in many often. When we discuss about any clinical issue, we discuss about the consultation skill. But I like to highlight here in the history station, not history station, rather history part of your consultation. These are the guidance headlines. This is given not only the left side panel, rather history can include according to the clinical situation for the female. You need to take this data. Another word we are telling, this is data gathering. 3P, it is our traditional learning throughout the world in clinical exam. Period, pill, pregnancy. Just to remember a simple mnemonic. Whenever you face a pediatric patient, these are extraordinary information you must know. You can remember in your AKT questions informations, AKT question stem, these informations are given. Even if you can open your question copy also or store, you will find it. So you need to do in your practice exam, that means the Osce exam. Elderly patient, additional message. If any secretion related data you need to know, for example, diarrhea, urine issue, sputum issue, these are the mnemonics help to get this information. So it's a very big list, definitely, no doubt. So again, detail, you will get it in the YouTube video, and further detail is written form as PDF available with us. Somebody already collected. Who are more interested, you can communicate, we will provide you. So these are all traditional things. But one thing I like to highlight here, very extraordinary, what we advise our colleagues. Whenever patient present to you any symptom, patient may present to you with any symptom or any investigation reports or any other extraordinary issues also. But our suggestion, you try to identify any additional issues patient with. For example, patient telling you, doctor, I am having fever for 5 days. That traditionally our colleagues are preparing in a manner that the colleagues are busy with the fever. Can you tell me more about the fever in this way? I know it. But in the last few months, we are guiding just keeping note that patient having the fever 5 days, only keep in your mind, or you can write in the paper also like a prescription pad. Immediately ask, do you have any other problem? What is the importance of this? I like to highlight only here, this thing only here, because our session today to tell you some new tricks. Okay, so who want to interact with me? 1 minute, please open the mic just to talk to me. I will tell you. Yes, Dr. Shoaib, thank you very much. I will tell you
Yes.
3 presentation. 3 means simple presentation. Any patient presented to you, doctor, I am having blood sugar report and blood sugar
Yes.
showing that fasting blood sugar high, 2 hour
Okay.
after glucose drink also high.
Okay.
You know that this is diagnostic of diabetes mellitus.
Okay.
Okay. That means you are facing a patient with the investigation report. Okay, that's enough. The report itself diagnostic, right?
Right.
Then you will ask, do you have any other problem?
Right.
So patient will tell you something different. Patient may tell that, doctor, I have the polyuria, polydipsia, so on, whatever.
Yeah. Yeah.
Even
Symptom.
non-resolving, non-healing ulcer, like complication of the diabetes, whatever it is.
Right.
Another patient presented to you, doctor, I'm having tummy pain.
Right.
So what is your diagnosis? What you are thinking about diagnosis?
Right. So I
So
will ask some questions.
yes, you will ask question, but by
Yeah.
hearing this, doctor, I'm having tummy pain,
Yeah.
you don't have any diagnostic clue. You
No.
don't have focused diagnosis is there.
No.
But you know mostly where is the disease, right?
Right.
Where is the disease? More
In the
likely
tummy.
disease in the abdomen.
In the abdomen, tummy. Yeah.
Maybe abdomen, maybe GI tract or glands relevant or urinary tract, or in the female mainly the genital parts in internal genitalia, like this.
Right.
Though it is not 100% perfect, but mostly where is the disease? Disease in the
In the
abdomen.
abdomen.
In the
Yeah.
abdomen. And the symptom is pain. Then you will go with the symptom further.
Yeah.
But
OPD.
OPD cats like that, what we have
Cat.
shown
Yeah.
there, you
OPD
will
cat.
go with this. But again, what you
Mm-hmm.
need to ask, do you have any other problem?
Yeah.
Where is the marvelous thing? You understood that patient having the problem in the tummy, but you don't know this is in the GI tract, urinary tract. But if
Right.
we ask, do you have any other problem? If patient tell doctor, I have burning urination. Now almost you are near to the diagnosis that patient having disease in the urinary tract.
Yeah. 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 Sure.
This is the glamour of the subsequent question. You know, it is called the open type question.
Right.
Further open question. Okay. I am not going further there. Third patient presenting with only fever. Doctor, I am having fever for 5 days.
Yes.
Okay.
Yes.
So where is the disease?
Yeah.
Dr. Shoaib, where is the disease?
Yeah. Well, it is a systemic uh, 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 symptom
Right.
present with fever.
Okay. But
Yeah.
where is the disease? Can you, like abdominal pain, you are telling or thinking it is abdominal disease more likely.
Yeah. It's not.
But by the fever? By the
Yeah.
fever?
It's not system specific.
Yes. So what will be the next question? Again, do you
Yeah.
have any other problem? Right?
Okay. Okay. Yeah. Yeah.
Then patient could tell, doctor, I am having burning micturition or burning urination. Doctor, I am having joint swelling. Doctor, I am having cough as well. So you
Yeah.
will be guided by the second
Okay. So
answer.
I mean, if a patient says that um, he or she is having fever,
Yes,
so we have to specify if there's any other complaints, right?
definitely. I'm
Okay.
not telling that you will ask one by one, too much, 5 or 6. Minimum one extra question better. for
Yeah.
examination purpose in the Osce.
Right.
Okay.
Right.
But in our real life, we have to ask more question also. Until patient tell that, doctor, I don't know.
Okay.
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 How much it is useful, you could try in your chamber, you will understand.
Right.
Otherwise, the traditional, what I observed from our previous colleagues, if patient tell fever, then the doctor asking, can you tell me more about the fever? So you are busy only one symptom.
One symptom only, right?
So one
Understood.
symptom is not much useful.
No.
Rather, if you
We
can
cannot.
accumulate more symptom in your hand in initial seconds,
Right.
it will be much helpful. So
Right.
we can make a prototype or set instruction that whenever patient present with one problem, I am not telling the symptom, rather investigation report is not the symptom. This is an presenting feature or issue. Minimum, I will ask, do you have any other problem? It is very extraordinary additional instruction in our sheet.
Yeah.
Okay. It is not much common in even in your clinical method book also.
Okay.
It will be
Thank you,
very
Dr.
useful.
Usman.
It will be very useful. You will
Right.
understand why I am telling this so a little later on.
Okay.
When I will show you overall the data sheet you will be collecting under the headlines, and this data sheet already modified, and for the first time we will show you today for the first time. Be with us. So overall, this is the history, and you will get details about it with the data collection skill in the YouTube again. This is open and free for everyone.
Thank you.
So I think we can switch now. And now the examination skill, again, it is customized by ourselves. In general, we observe the patient and examine under the headline of so-called general examination. Already you know about many issues and how to sectorize. For example, our headline is general observation with general examination, focused systemic examination, and bedside or point of care test. I like to highlight it, point of care test. Please, again, who can say about point of care test? Other than Dr. Shoaib bhai, any other colleague, please? Point of care test. You will do in your chamber. This is a very extraordinary family physician's job, rather to say. Dr. Hadi, Dr. Javed, please.
Yes, Doctor. Assalamu alaikum.
Sir.
Yes, you can check urine analysis by dipstick.
Yes,
That is
very good.
here.
Any other?
And ultrasound, I think, will be difficult
Ultrasound
for the
doctor, you need
GP.
to be having
Point of care.
advanced training and more investment also, but with other simpler thing, cheap. Dr. Abu Amar.
Blood sugar.
Yeah, Dr. Aisha.
Blood sugar we can
Yes,
check by glucometer.
yes, by
Yes,
glucometer. Can anybody add a third one?
Pregnancy test.
Dr.
ECG.
ECG, right?
ECG.
If you can invest the ECG. Any other thing?
Endoscopy? Should we do?
Endoscopy,
No.
actually, it is not investigation or test, rather it is a clinical examination.
Clinical
But you
test,
can make
okay.
it. You can make it under the point of care test also, though it is a clinical skill, right?
Yeah, clinical skill.
But we are sending patient outside.
Blood film for malaria.
Malaria, yes. If you are oriented with microscopy, it will be again your bedside test. Sorry, but not bedside. If I say about the family physician, general practitioners in the outdoor, it is a point of care test. Again, what Dr. Javed said, that ultrasonography in South Asian countries now available. Dr. Shoaib can tell us, I think, about as a senior gentle colleague. Handy sonogram machine is available in the country, is not it?
Yeah.
It is available. It is available. And all family medicine clinic should have it. Okay. If we think this is our business, we must invest. Anyway, I'm not going there detail. Already we discussed about the point of care test for my native doctor colleague, not in maybe in international format also, I forgot. So from there in the exam also, you can excel. You can make your presentation or discussion excellent by adding this point of care test. Usually, again, it is a new topic for you. 5 years before, 10 years before, even I can remember during our preparation time, we included blood test, urine test under the headline of investigation, which used to be sent to the lab. But it is not actually lab test. This is point of care test. You will add in your discussion whenever needed. It may be relevant directly with the presentation or as a routine. For example, blood sugar is a routine examination, routine test. So it is called point of care test. Otherwise,
patient supposedly asthmatic, so we can do peak expiratory flow rate.
Definitely.
Or spirometry.
Yes,
point of
yes,
care.
yes. And if you go through in the internet also, you will find the bedside spirometry. It is available in the market.
Blood gases also.
Dr. Abu Omar, what about?
Blood gases.
Yes, but blood gas, doctor, is still costly for South Asian perspective. In the blood gas, if you work in the emergency room, I think it is more allied with the emergency room, but not in our general practice in outside.
I think blood classes will be difficult because you have to take arterial blood.
Arterial
so
blood.
arterial
It
blood,
needs a special skill. Special skill. But other thing, yes, another thing, easily you can do it, right? Just to fix the what I say ECG wire, leads, make it. Just prick the finger, draw the blood, and make the sugar. Just tell the patient, blow there, get the result of the peak flow meter. But A, B, G, a little bit different. But you can do further many other things. So I don't like to go there, but I'm telling that in your exam, as today's discussion surrounding the exam. So for the exam, minimum urine dipstick, blood sugar. Two things. Don't forget. Including ECG is better because ECG needs sometime emergency decision making for the chest pain patient. Okay.
Right.
So the pulse oximetry, sorry, don't forget pulse oximetry, oxygen saturation, including the pulse. But don't do mistake to check the rhythm of the pulse because oximetry cannot tell you the rhythm. No. This is a trap for you. This is a trap for you. So up to this enough. But sector, I like to tell, the examination plan should be by handshake. You start with the handshake and go down one by one. If you can see in the screen, we followed a sequence. Okay. And at the leg, it will be ended. And these are the vital signs: blood pressure, temperature, height, weight, including, and SpO2 also could be point of care test. Okay. And respiratory rate also, you can count also, no problem. But I ask you, or you can think that, do we need each and every point for each and every patient in our practice?
No. It's dependent.
Definitely no. Definitely
patients
no.
complain.
Yes. It is called focused examination. Okay. Focused examination. We hope we will sit you by the mercy of Almighty in another day to discuss the focused examination detail.
Inshallah.
But for example, already I told you the focus history, rather, I told you before in the previous slide by how to do focus. That means the meaningful data. Second is the focused examination plan. So this is overall a clinical examination planner. You can preserve it and you can think. You can think. I think all of you are mature candidate. You understood what does it mean. Okay. For example, if I show you a respiratory examination plan, those any colleague preparing for the PACES, I don't know here. And this is very, very important PACES compatible examination plan. It is a realistic, no doubt, but for exam oriented, you know that there is an examination station, do chest examination. There is no other clue, or maybe clue of cough, something. So the whole station assesses your examination skill of the respiratory system. But in your Osce, it is not like that. Though patient have cough, if you go with the whole thing, Dr. Shoaib bhai, another colleague, how many minutes you have to utilize there on an average?
I know. At least 5 minutes.
Yes. In the PACES exam, maximum 6 minutes. Not more than that. So you need to do 5 to 6 minutes. If I tell that in the PACES exam, there are findings are there. You have to assess For that, you need to pay 6 minutes together.
Right.
In your
Right.
OSCE, there will not be any finding. Finding will be given verbally or by written card or like these.
Okay.
So you may need less time. It is true.
Mm-hmm.
But if you do each and every point, minimum you have to do 5 minutes.
Yeah.
But in a real exam, only examination require 5 minutes. What will you do? Remaining thing, the remaining 5 minutes.
Yeah.
For this reason, we need to examination required examination points meaningful.
Okay.
This is a matter of practice and this is the matter of case understanding. Okay.
Right.
But this is an rather to say blueprint in front of you for the respiratory system related examination plan. You need to have this type of plan for each and every system. But we need to be very choosy. And definitely, if I ask you that patient presented with cough, with the fever for the 5 days without any previous history, apparently patient was healthy before, no disease even in the childhood, should we see the clubbing? What do you think?
No.
Most likely no.
Most likely no. Yeah.
Most likely no. Clubbing usually a feature of chronicity.
Chronic disease. Yeah.
Chronic fibrous disease or
Fibrosis.
pyogenic disease. Okay, no need. In this way, you have to segregate. It is called the planning for the focus examination.
Focus examination. Okay, understood.
Right. Now, come to the checklist. Have you heard about the checklist? Yes, those who are preparing the OSCE, definitely you have heard the checklist. And how to prepare a checklist. If you give me few seconds, I can show you. I need to stop this sharing. I will open it again, don't worry. And I am opening another sheet for you. Just give me a few seconds to share the checklist. And tell me again, can you see the screen here? Please, any colleague?
Not yet.
Just wait a few seconds.
Yeah.
I think you see now.
No, yeah.
Okay. Dr. Shoaib, can you see?
Yeah, daytime sleepiness. Is it
Yes.
so?
Yes.
Yeah.
This is actually customized checklist developed by ourselves. Okay.
Okay.
You may have different sheet and other. By reading the checklist, you would have a map or blueprint how to explore the station. I will just scroll up. You just go with me few seconds. This is the headline. Patient usually will present to you with the daytime sleepiness, excessive. And your core diagnosis will be obstructive sleep apnea. Again, there could be another reason for the obstructive sleep apnea. There might be enlarged tonsil also. There might be hypothyroidism also, right?
Right.
Could be. But primarily, diagnosis will be obstructive sleep apnea. So if you go through the checklist, so you see your designation is the GP, and the scenario mainly a 46-year-old patient attends your clinic complaining excessive daytime sleepiness, poor concentration, and persistent tiredness for several months. This is only for learning purpose. These long instruction will not be given in your exam. Remember it. Okay?
Yeah.
Because your patient will not actually tell you earlier before entering your chamber that doctor, I will have this thing. Okay?
Okay.
Patient enter your chamber will tell, you will wish the patient and you will tell, how can I help you? This patient at best can tell, doctor, I'm having trouble for my sleep, especially I become more sleepy at the daytime.
Right.
How will you get the other symptoms? Poor concentration, persistent tiredness. What is the clue? By asking, do you have any other problem? Clear now?
Yeah.
Definitely, usually, patient will tell you these three things. Still, you are not reaching the diagnosis. These are again general features. In these general features, sometimes your case may be tricky and complicated. Anyway, I am telling about the checklist of the topic daytime sleepiness. And in general, the expected task to be accomplished by you in the exam, these are written as such. If you see the highlighted words are there, focused
Yes.
history of the daytime sleepiness, the fatigue, and explore other symptoms, functional impact, safety issue, that is the safety netting issue, driving, work-related risk. Is it the part of our traditional symptom-based history taking? What do you think? No.
No,
No.
actually we don't ask. Yeah,
Driving rather a social history, legal issue.
very important.
Legal
Yeah,
issue, legal issue.
yeah,
And these are history relevant comorbidity. Patient might have diabetes, hypertension, and others.
yeah.
Explore the patient idea, concern, expectation.
Expectation. Yeah,
Yes, it is called ICE. Without ICE and the impact, usually OSCE candidate cannot pass.
ice
And
and
now
impact.
you will formulate likely diagnosis. Okay.
Mhm.
So after getting the data and the examination required, if needed, you will come to reach a diagnosis of obstructive sleep apnea due to something there. If you cannot understand, you will tell that the cause, further cause for under evaluation, but your primary diagnosis is obstructive sleep apnea. Then you will plan investigation. Then further management according to the underlying causes. If it is hypothyroidism, you will treat the hypothyroidism. Okay.
Right.
Safety netting and the follow-up. So these are the core thing. You must do it. Now, if you imagine the history sheet we have shown you, the examination plan we have shown you before, do we need each and every point for this patient?
No.
Definitely no. So checklist will help you. What will be the meaningful points you need to address? For this reason, you need to read the checklist. Okay?
Okay.
Because your diagnosis is more likely here, the obstructive sleep
Sleep
apnea.
apnea.
But daytime sleepiness may not be due to any organic underlying disease. If I tell you daytime more sleepiness, could it be due to lack of time in the night time, especially by the mother, lactating mother? What do you think?
Yeah, possible.
Possible. So in that case, your tasking will not be this thing. Is that it?
Yeah,
Will not be this thing. Your task will
yeah,
be a little bit modified. Okay.
sure.
But in the exam also, in the instruction, nobody will tell you what will be your tasking. In the course of discussion, especially for the data collection, it is
Yeah,
your ability to pick up the points and to know more
I see.
about according to the case presentation. Okay.
Yeah,
So this is up to you. That is your job, and it is actually we design it as such. This is the core thing for your tasking. But you go down. I will not take more time here. The checklist point wise in the OSCE practice, we develop 10 to 11 points. Greet and meet already we have shown you in the data collection form. So how to start with these? It is your job. You need to practice it. Then the data gathering about the symptom. Then especially as patient tell you daytime sleepiness and other features, as the sleep related issues are there, then the next point important will be nighttime sleep history. Is there any snoring, any positional issue and other issue? So if you go down, especially for the symptoms, if I tell about the C up to the C point, you may not remember each and every point. If you go through the checklist just as a paper reading and try to remember a little, in the practice time, you need to ask, do you have any other problem? That is the second point we'll tell you. Okay. At best, you can focus some question as close question. Close means focused symptom. For example,
yeah,
you could ask about the nocturia. Do you have the more urination at the night time? This is a closed question. It is not open question. Do you have heartburn at the night time when you go to sleep? This is a closed question because
Right.
it can disturb the night sleep
Mhm.
and can again cause the daytime sleepiness.
Sleepiness.
So this is the question types. I told you the consultation is skill, how to ask the questions. Usually start with the open question, more open
Right.
question, 2 or 3 open question, then go to the closed question.
Right.
And it is easy.
Dr. Usman, if I
Yes, please.
may have the permission to say something.
Please.
About the snoring, I mean, the patient will not able to him or herself say that I'm having snoring, right?
Definitely. If you suspect the snoring,
Yeah.
how to ask as a third
So
person information,
we'll ask him or her if it is he
then
that
ask
if
her.
your
If it is she,
wife
ask him like
complains
that.
something. Yeah. Okay.
Spouse. If a spouse is
Yes,
not
boss.
there,
Yeah, from
will
the
you invite the spouse to be there in the chamber time because lady wife is cooking?
yeah.
How to ask it? This is the scale. Just ask that what your spouse told you about the night issue. Do you snore at the night? Indirect
Yeah.
question.
Only
Indirect
the spouse
question.
can tell. Yeah.
Yes, a spouse can tell if a spouse is accompanied there.
Right.
So there are many other techniques in the data collection. Hopefully, again, we will discuss some technical data collection, how we will do. Okay.
Do we get it PDF format later on?
Already this type of many checklists available in the module, doctor.
Okay.
More than 50, maybe near about 100, we already prepared. I am just showing one sample today for your easy understanding. Let me proceed now. So after this symptom analysis, daytime symptom risk assessment, especially the driving. Okay. So if you remember again the history sheet, driving could be a part of the social history, personal history at the bottom.
Right.
At the bottom. But in this case, driving issue could come earlier because life endangering situation could be there. It could be a red flag here, rather to say.
Right.
For this reason, you need to ask it earlier. It is called the risk stratification or risk assessment. Okay. And these are the etiology, risk of the daytime sleepiness, especially obesity, the musculoskeletal problem in the neck, ENT disease, male sex, and other things. Now about the past medical history, about the hypothyroidism issue.
Excuse
Okay.
me, Dr. Span, can I
Yes.
just interrupt one thing?
Please.
Because Epworth here you mentioned Epworth sleeping scale. So we have this is actually 24 points.
Yes.
So I think it'd be too much time consuming to ask all points.
How to do it?
Yes, because it is I think
I will
24 points. 24
Okay.
points.
I like to
Yeah.
give a pause, Dr. Javed here. Let me finish the points, then you will remind me again after finishing this thing related to the case. I'm just showing you the steps. Actually, we are not discussing the obstructive sleep apnea case detail. I am showing an example of the checklist only. Just be finished with it. Then I will tell you. Past medical history. Do you think that past medical history needed for the obstructive sleep apnea or not? Okay, if you think about the hypothyroidism, it is definitely needed. If any fluid relevant issue could be there, accumulation, definitely needed. So how to ask the question again? Did you have any illness before other than this time? This is enough. This open question is enough. Otherwise, if you ask about hypertension, diabetes, it will take again 2 minutes time. So how to ask again? This is a matter of practice, but you should have this information in your mind. This is the checklist in the mind. Okay. Again, drug related issue, sedative and others. Okay. Daytime sleepiness due to only for the sedative taken at the night time could be. So don't think that each and every point important. Actually, if you start with the patient within 1 or 2 minutes initially, if you are oriented enough how to cross the case, it will be very easy. Okay. So one by one, these are the points about the data collection only. Patient concern up to there. In the physical examination, already we discussed general observation, vital sign. and focus examination inside the throat. Sometimes it is called the Melampathy score. If you don't know, I think no problem, but if you know, it's better. Melampathy score regarding to see the space in between area, you already understood. Already we got it for that we are showing. Is a crowded oropharynx or not? So you could see the tonsil, you could see these space also in this way, especially regarding the cardiovascular disease, may be relevant with the complication. Okay, there could be right heart failure features also as a complication. If patient tell you the breathlessness or leg edema, then at that time cardiovascular points will be relevant more. Respiratory disease and management part. Already I told you management means your initial clinical management, initial clinical diagnostic formulation is important. So you have to select the or prepare the likely diagnosis. Our likely diagnosis would be obstructive sleep apnea. There are many other syndromes. And serious will be the central sleep apnea is central nervous system relevant, and hypothyroidism is the endocrine disease. In the checklist, if I ask you, if your diagnosis is obstructive sleep apnea, what will be your system relevant with this, Dr. Javed?
Snoring will be there.
Snoring, what the system relevant, doctor? Your diagnosis probably obstructive sleep apnea. What the system?
Respiratory.
You can say respiratory, upper respiratory.
Yes.
But not the lower respiratory.
Yes, sir.
Okay. Other colleague trying, your sound is not clear. You can check your audio. If it is hypothyroidism, then it is endocrine. Okay.
Any ENT problem? ENT.
Yes, ENT tonsil. Oh, if you say ENT means upper respiratory, for example.
Yeah.
But if it is hypothyroidism, it is not relevant with the respiratory system. Okay. It is not relevant. What I like to say, when you prepare yourself in the exam, by reading the checklist, don't read it as systemic checklist. Understand my point? Dr. Javed and other colleague?
Yes, sir.
Because this checklist may be underlying diagnosis with the endocrinology. These checklists may be underlying diseases even for the carcinoma of the larynx is oncology, for example. This checklist may be nothing else, no organic disease, only the sleep deprivation at the night time. Could be daytime sleepiness. For this reason, we have to be busy with our patient, not the systemic checklist. If you go with the system, you will be blind. I hope you understood what I mean. Blind means you will not be able to reach the diagnosis. Always you are thinking that the snoring means obstructive sleep apnea. Obstructive sleep apnea means enlarged tonsil. It may not be true in your exam. Then you will have to face the trouble. So checklist will be the problem wise. Though we have given a probable diagnosis here, but our main agenda is the daytime sleepiness. Okay. So in the management part, after clinical diagnostic formulation, you will go for the investigation according to your probable diagnosis. But the first thing, whatever the reason, is sleep study. I think all of you know those already come across the AKT. It is called polysomnogram. In our layman term, we tell it sleep study to check the severity and other respiratory oxygen saturation, ECG even also. They made the video recording. In the Osce, you have to explain it to the patient. But if we think about the hypothyroidism, then we will include thyroid function test. If we think there is enlarged tonsil, we don't go for the thyroid analysis. Rather, we will take the input from the ENT specialist or ENT clinic. Likewise, investigation plan will be there. And in the Osce, usually they will not provide you the findings. Those who appeared before also, I am not sure you came to know about it. You have to tell your planning of investigation in general. Okay. Then, as you have the primary diagnosis, you can tell some management. It is called again the primary management. For example, lifestyle issue easily you can tell, reduce the body weight, take sleep, maintain some sleep hygiene and other, the sleep on the bed in the side, keep your hand and above. Anyway, and for the spouse also, this is important issue. Spouse is to use some ear plugs so that she should not be disturbed at the sleeping time. Additional message you can tell. But about the thyroid, you will get the report not today, day after tomorrow or tomorrow. So second sitting is remaining for the management. This is the realistic approach, not that you are giving the treatment for the hypothyroidism. So you will wait for that. Anyway, in addition, comorbidity management, diabetes or other diseases are there. Comorbidity may be complication also. Right heart failure can be complication of the obstructive sleep apnea. Okay. And if you need referral, we will discuss today maybe ENT referral or sleep specialist as well. Safety netting, driving issue could be there. Okay. And the lastly, 7 point is the closure of your consultation. For the special note, there are some things for the sleep study as a preparation of the sleep study. Every station it is not needed, but some message you need to prepare your patient earlier. You have to tell that I am sending you for the sleep study. During the sleep study, you should not have the nail polish or any gel. It will interrupt the oxygen. Even it will interrupt the oxygen saturation, by pulse oximetry. If patient have the nail polish, it will interrupt because it, they interact with the color of the fingers. So this is also your part. It is very extraordinary. What I mean, this type of checklist will give you almost 100% information store for you. Understand, Dr. Javed and other colleague? If you go through such checklist, what we actually prepared for you, definitely you will get the benefit of this. Dr. Javed, please be with me now. As you said about Epworth scoring. Epworth scoring. It is a big list. Count the dosing, right? Count the dosing. You know the dose.
Yes, sir.
Dosing. So they tell you how much severe the disease process is, right? So
Yes,
for
sir.
technical purpose, it is not for this. You have to do audit questionnaire for alcoholism, right? Audit. And recently we have seen for the smoking. Smoking, what that one? Dr. Shoaib can help us. Maybe 2 days before we discuss about the smoking. What else? I forgot it. Very recently, there is another scoring. That means for addiction management, another scoring. You may not remember it, but minimum remember the name of the score. Naming headline, like Epworth, like audit, or so-called cage questionnaire. What you will do? After consultation, already you got the diagnosis. You will tell that I need to do Epworth scoring for you, Mr. or Mrs. Someone. I will do it after this session. Enough. Okay, Dr. Javed?
Thank you, sir. Now,
Because
just
you will not have, definitely you will not have time. You have to cover many points already. I have told you 7 points are there in general. You have to follow this for your body language, for your etiquette, for your examination. So scoring system, if I tell you about the international scoring for the prosthetic symptom, again is a big list, right? Again is a big list. Only tell that I need to score for your symptom. I will tell you, I will do it after the session. Up to this enough.
right, sir. Thank you.
Enough. So regarding the checklist, doctor, if you have any query, immediately you can open. Otherwise, I am closing it. Anyone to ask about the checklist? We tried it very useful for you by customizing, and we are working with it last few weeks also. No more? Okay. So again, coming to our PowerPoint, Dr. Javed can help. Can you see the PowerPoint now?
Yes, sir. Now visible.
Thank you. I don't know why some colleague asked me that in that chat box. You can open the mic, doctor. Asking that the general physical examination from where to start. Already I have shown you, doctor, you have to start general examination from the hand. That is when you shake the hand, you started your general examination. You're touching the patient. Otherwise, I have to say that your general observation without touching, you have started. This is also part of the general examination. So you
Doctor,
start
over
from
there
the
the hand,
hand.
Sorry, Dad. Nowadays handshake is a compulsory. Before Corona
Doctor,
was there.
open. Can you check your audio, Dr. Kumar? Your audio is not clear. Maybe lose connection. As I understood, the nowadays, especially for the COVID, in the last few years back, for the COVID issue, they prohibited the handshaking. But nowadays situation is relaxed. Okay, situation is relaxed, and traditionally handshaking is a very good clinical skill. Okay, Dr. Kumar, you can enlighten us if you have heard recently anywhere the handshaking is prohibited or not. Otherwise, we have to proceed with the handshake. Okay, but culturally, there might be some limitations in South Asian, especially if cross gender is there, male, female is there, and it will not be a major problem. If you extend the hand, if opposite gender is there as a surrogate, she or he may not extend the hand. You will understand it. It will not be a major problem. But is a clinical etiquette as a source of information, shaking hand is good enough. Dr. Kumar, please be connected. You're trying, maybe.
Yes, I understood.
Sorry, your voice. Okay, I will try my best to understand your voice. Don't be frustrated. Okay, so start from this hand, no problem. And then other thing, go up. You see, if you make a picture also, if you start from the, if I show you again here like this, Dr. Kumar, can you see? For example, respiratory system, you start the point from here by arrow. General observation, then point 3, 4, this is organized in this way. Hand, eyes, mouth, neck, come to the chest. So if it is a cardiovascular, again come to the chest and go to the abdomen or go to the abdomen. Then finish by the leg. So it is an example of this sequence for each and every system. Okay, doctor. So we discussed your the checklist issue, and then this was our traditional data format, rather to say headlines. Our plan today, how to modify this. Even if you hear our recorded classes before, 1 year before, you could see that doctors were following this and they become successful. Okay, even those who attended few months before with us, we followed it. What I like to say today, still we will follow it, but to make an special arrangement. That means in your OSCE case, your data should have all the things, though with some modification. You will make shortcut something. You will take some data earlier also. That I told you, driving issue regarding the daytime sleepiness could take the lead. Okay. For example, driving issue will come in the history sheet as a part of the social or personal history. Okay. But what do we do? If you remember in your day-to-day life, even in my practice, okay, be with me, Dr. Shoaib by minimum or any other colleague. If patient enters
Listening.
the chamber, usually some doctors do good evening or assalamu alaikum, please take your seat. Is that it? I am looking the patient from head to toe, and is a very gentleman. We are asking, may I know your name, Mr. Johnson or Mr. Abdul Karim? And then asking, what is your age, right?
Right.
But sometime we are asking, what do you do for your living? Is that it?
Yes.
Is that it?
Yes.
It is called the particulars of the patient. Is that it?
Mhm.
But according to the book knowledge, it is a part of the social history.
Okay.
Occupational history is a part of the social history. But for
Right.
practical purpose, we are asking, what do you do for living?
Right.
Someone
Right.
bank manager, someone teacher, someone doing something else. In the OSCE, this point nowadays becoming more important.
I see.
Understand?
Mhm.
It is a part of the social history. So I will show you a little later the finalized checklist, what it would be. Okay?
Okay.
We actually reform this thing in a modified one. Please, everybody look at this. Is our main slide today. of whole discussion. The update we collected after last Osce exam, whenever you start with the patient, be confident about the patient's occupation. Because if occupation is hampered by the symptom, it is a valuable information for you. Even you don't reach the diagnosis. Okay, Dr. Shoaib?
Yes, yes, I got you.
For example, patient having problem in the legs. There is a leg pain.
Yeah.
And the patient is a daily laborer.
Right.
Don't we think that it will hamper his or her job?
It will hamper, yeah.
It will hamper.
Sure.
This is your point. You shouldn't miss it.
I see.
Okay? So how to do it? Though we will be very puzzled about our diagnosis, by our learning process, traditional learning, mostly we are attending the diagnosis till now in our medical colleges. This is our prime point, no doubt, but not ignoring other issues. In the family medicine, our traditional diagnosis is biopsychosocial diagnosis.
Yes,
So maybe you have heard it.
Yes.
Biologic diagnosis, social diagnosis, and the psychologic diagnosis also.
Right.
Sometimes we tell spiritual issues also, plus minus.
Right.
Then it will be a completed diagnosis. So if you ask about the social history, then you will get the social diagnosis.
Right.
If you ask about the economic status, it will give you the social diagnosis rather to the socio-economic diagnosis.
Right.
If you ask about the mental condition, how do you feel? Or if you ask that how it is impacting your daily life, it can give you the mental status also.
Right.
That means you are getting the diagnosis without going in depth. For example, obstructive sleep apnea, you formulated this initial diagnosis formulation.
Okay.
Obstructive sleep apnea. It doesn't mean past medical history also. If a spouse telling that my husband having the snoring and sometimes she is to wake up at the night time is not enough. This is enough. This is enough. It doesn't need the past medical history. It doesn't need the family history. It doesn't need the social history for the diagnosis.
Right.
So you don't need go to the past history, drug history, other. In the initial line, I'm telling the first tier or the first paragraph for you. Why I'm telling, in course of your discussion in the exam, you may not have enough time to to get the social history, to get the idea, concern, expectation, to get the red flags. If you become busy with the diagnostic flow more and more in depth, understand my point?
Right.
So after your initial diagnosis, try to know about the idea, concern, expectation, identify the red flags, impact in life, if any legal or ethical issue, especially the driving or job related sick leaves, or sometimes some hidden agenda could be there. I will discuss hidden agenda another day if possible.
Okay.
For this reason, we have put the box up in the script. You can see now it's the same box, right? In the same box, we put it up. So try to gather all those information in your first paragraph. Then go to the relevant question. If it's a female, 3P. If it is a child, P blind, P bind, and elderly for ID. Already you have heard it about before.
Yes.
Okay. I am not telling that it is ignorable, but it should be in the second line. Yes, doctor, raise the hand, open the mic, please.
Yes, doctor, I want to ask, what is the right time to ask the eyes?
After getting your initial diagnosis.
Okay, because some mentors were saying that you can ask just after HOPC.
After?
So, a history of presenting complaints.
That is the thing. Initial diagnosis, mostly you raise very nice and technical issue. Mostly you will get your initial diagnosis after history of presenting illness.
Right.
Okay.
Right.
That I actually mentioned some as a summarized. Lately, I didn't tell you the word bottom line. You are very right and other mentor also right. After
So, for
initial
example,
diagnosis, yes.
For example, after a history of presenting complaint, we have not come to the diagnosis.
That is
So,
an
shall we move forward, then ask the eyes, or we should ask?
very, very good question again. Usually, mostly will reach the diagnosis if you are good enough to take how to take the present history of presenting illness. Okay, you may miss it. Okay, until you reach the diagnosis, actually, you will not be happy. It is very, very true. Doctor, please be connected who are talking to me. It is better because I
Yes,
need
yes,
to I
yes,
need to interact with
yes,
you.
doctor, yes, I'm here.
For example, then you will follow this drug history, past history, family history.
Yes,
If it is a clinical diagnostic or clinical management station, obviously you will reach the diagnosis. Otherwise, what is the flavor of the station here?
exactly,
Exam will not be that much complicated. Remember it. Diagnostic hard work that will not be that much complicated that a mature graduate doctor will not be able to reach the diagnosis. Remember it. Because
Mhm.
if they want to make a puzzle for the diagnosis, how they will assess your examination skill? How will they assess your counseling skill? How will they assess your management skill?
Exactly.
This is the philosophy. For
Mhm.
this reason, we are sitting here together, doctor, to discuss. Understand? So
Yes,
think
yes,
it.
I got it.
And regarding the examination I am now talking about, I think you understood your data about, right? How to deform and reform the data. Clear now, doctor?
Yes, yes,
Up
doctor,
down.
thank you.
Make it up down. Again, don't forget ICE, red flag, lifestyle issue in the management part. I have given the lifestyle not for the management. You will manage in the lower box, you see lifestyle issue and other in your management non-pharmacologic treatment. Just I have written the lifestyle here just to identify any lifestyle issue, including the diet. You know, the diet is a part of again social history. We made for the PACES candidate before many years before I know. But for your exam, lifestyle issue, what about your sleep? Already job you asked about. Take the information, especially the obesity and others is important lifestyle issue for the obstructive sleep apnea. So this is your data box. You will tell the management later on. Smoking, alcohol, all things are lifestyle issue. You just note down. We tell it problem list. Problem list. For the problem list, you take the data by the history rather to say. But you know that examination finding also will be your red flag. Could be. But in general, in the exam, they will not tell you examination finding as the red flag. In general, very less often they tell the red flag issue. They sometimes tell you only the diagnostic finding. For example, for the pneumonia, they will tell you after the examination of the chest, they will tell you there is a bronchial breath sound in the right upper zone and so on. So focused examination. If I tell you about the fever, already fever, I started with the 3 patient. One with the fever, another is Dr. Schwab can help. Another is the abdominal pain. Another one, only the investigation report of the blood sugar. I think you
Right,
can
right.
remember.
Yeah, yeah.
If it is the febrile patient, okay, so you come across the data sheet, then you are able to reach the systemic focus that patient might have UTI, okay, or patient have the productive cough, patient might have pneumonia. So as a part of the as a part of the examination, focus examination, under the headline of general examination, you will check the lymph nodes, respiratory. Lymph node means if acute case, no need to see the lymph node. More likely with a chronic case. And subacute case can produce lymph node. But respiratory rate, oxygen saturation, cyanosis, these are very important. If it is a little bit subacute or the chronic, then it will be the clubbing, mandatory. In the examination of the general examination part, you finish, then come to where? Doctor, anyone can say. After general
For
examination, you will
example, if it is a UTI, then
already
we will
above the
do the
calf. I am
renal
telling about the
function.
calf, about the calf. You will go
Then
to
we
the
will just
chest,
do the yeah, respiratory only.
respiratory. Now, I exchange the views with the examiner panel in the OSCE. I had some discussion also, some criticism also. In a meaningful sequence of focused examination, it will be again, you start from the hand and will be ended at the leg, for example. But in the OSCE, they expect that whenever you focus the system in the chest, you have to do full chest examination. But practically, meaningful examination can be designed in a manner that you don't need to go with the inspection, palpation, percussion, auscultation points for the each chest disease issue. I can prove it. If you can see somebody seeing our module, we have provided some recorded this type of station records in the English versions. Though it was designed for the PACES exam, previously it was a 10-minute station like your OSCE exam. So we provided the records of the video. Those who have seen it, you could see they are not following the inspection, palpation, percussion, auscultation. And this is very, very fact. Doctor, do you understand what I mean?
Yes, yes, yes.
For example, if patient have the heart failure, okay?
Right.
Patient have the heart failure. If
Right.
you examine the chest for the cardiac, what is our expected findings there? The size of the heart is enlarged or not, mainly.
Right.
And if you go back, basal crepitation, right?
Right.
Basal
Right.
crepitation. No need to check the upper part of the lung.
Okay.
It is a very philosophical thought I am sharing.
Okay.
Understand? And then come back to the abdomen.
Yeah.
And check there is
Abdominus
ascites
liver.
or not, hepatomegaly is not there or not.
Yeah.
And go to the leg. If the leg edema
Edema.
is there or not.
Yeah.
Overall, you need to check the breathlessness, cyanosis, and pulse oximetry.
Right.
So many, many things are there. Many, many things are there. But for your OSCE preparation, my suggestion is that select some signs from the general examination and go to the area of systemic examination. Mostly in stations where you need to examine will be focused systemic station. Clear now?
Yes.
That means from the history, from the data, you will be able to select which system you need to examine. Understand my point?
Okay.
For example, if I tell you chronic fatigue syndrome, you know about, you attended the discussion, chronic fatigue syndrome or fibromyalgia. Actually,
Right.
you cannot focus where is the disease. Understand?
Right.
In general, in the exam, they will design such station only for talking. Mostly.
Counseling.
Whatever you say, counseling and further management. Understand? Not for examination.
Yes.
Because if patient tell you, I have doctor joint pain, I have weakness, muscle pain, I cannot see well, I am having the palpitation, you have to examine cardiology. You have to examine the musculoskeletal system. Isn't it? So how many
Yeah.
systems will you examine there?
Difficult.
But it will be easier if it is a manner that, like a traditional OSCE in other world, like PACES exam, you will select 8 or 10 examination finding from general examination and overall from hand up to 2. This is one of the format. But for your OSCE, actually, this is the understanding hidden informations. They will not design such chronic fatigue syndrome or fibromyalgia for examination. Abdominal
Okay.
pain, commonly abdominal pain, they will select for examination purpose. In the 14 station, you need to examine 3 or 4 station for the
Okay.
examination to check your
Mhm.
examination skill. If
Okay.
you have the chest pain or the cough, okay, it will be the cardiology or the respirology, pneumonia. Like if it is a joint pain and swelling, definitely it will be very clean cut to you. It is arthritis patient. Then you will select musculoskeletal examination.
System.
The
Yeah.
format is GALS, right? GALS. Gait, arm, leg, and spine. This is the
Okay.
format. If it is the unilateral limb weakness, Your focus will be which system?
Nervous system.
Neurology,
Neurology.
nervous system.
Yeah.
Which part? Initially the lower limb.
Lower limb, yeah.
I think this is enough. Neurology usually longer systemic examination. So this is your focused examination. And recently, observation of the Royal College is our candidates are very reluctant for the examination. They are getting less mark in the examination. What is the reason? Because candidates are thinking that there is no findings.
Yeah, okay.
Okay. So
Okay.
they are very reluctant. Even they are not
Mhm.
keeping the stethoscope on the chest until the breathing cycle is ended by the patient. You can
I see.
imagine in your real life practice also. I'm sorry to
Mhm.
say, you are also doing the same. When we put the stethoscope only for the psychological purpose of the patient, we don't need to hear further. Only putting the stethoscope on the chest, just touching and removing, touching and removing. And
Okay.
it is being done in the exam hall. So these skill they are assessing. So by the mercy of Almighty, we will sit with you with the focused examination skill later detail.
Inshallah.
Up to this there. Focused means you need to make general examination plus focused systemic examination. Remember the word. Okay, this is very new thing for you because I remember I guided other before the candidates about the overall the practical aspect. Okay, and some points in the system and some point outside the system. But a little refreshing phrase is it is termed as focused systemic examination.
Okay.
Understand? That's all.
Okay.
How to do it? You have to practice more. How to you examine, because you know that there will not be findings, but you need to practice it: inspection, palpation, percussion, auscultation. According to that, you are thinking that there might be finding. You have to do the examination in this manner.
Mhm.
So this is the skill already done. And then go for the management part. Definitely investigation plan, including the POCT fast, already discussed. Before investigation planning, you have to tell your diagnostic summary. And summary, already again I told and discussed with previous colleagues, summary may be like a rubber, elastic. You have to say summary in 1 minute. Sometime if you have enough time, sometime you have to say the summary within 20 seconds, 30 seconds if you don't have time. Again, it is a matter of practice. If you come to the practice, you will learn it later on with us. But summary is important. Without telling the summary, they will underestimate you. Okay. And then solve the problem. Red flag, eyes, and other things. Solve the problem list. If patient doesn't have the money, how to arrange the money? It is also social issue, economic issue. And it will include the management in this point, non-pharmacologic, pharmacologic treatment. Whenever you tell the management by the medicine, try to tell the side effect of the medicine and what patient is to do. Then they decide OPD follow-up. In general, they expect OPD follow-up and referral sometime needed, hospitalization sometime needed, and safety netting. Already you collected the red flags and the safety netting. Opportunistic health promotion, cigarette smoking, obesity, though unrelated with your presentation, smoking, alcohol, everything. So this is a modified, rather to say, data collection format for you or information collection for you in the Osce exam, doctor. Any query up to this now, doctor? I hope we can finish within few minutes today. If any query about this,
We
you
have
can
to
ask.
practice. Yeah, we
Yes,
have to
practice is
practice it.
important. You can ask
Yeah.
in any other session also. I am giving an overview though. Okay.
Yeah.
So,
Yeah.
so look at the right panel of this same slide.
Mm.
Mr. Kadri anxiously waiting for you. For you means to talk to you.
Yeah.
Kadri's age is 65.
Right.
Okay. Blood
Right.
pressure normal, pulse 96. Proceed with the consultation. So patient is anxious only. There may not
Mhm.
be this information also. You are not gazing where is the disease.
Right.
So how to start with? How can I
May I
help
help
you?
you?
How can
May I
I help
help you?
you? How can I
Yes.
help you?
How can I
Patient
help?
telling that, doctor, I'm having racing of my heart.
Racing. Okay. Palpitation.
Then what will be the next question?
Mm-hmm. It
Dr.
could
Shoaib,
be,
what will
yeah,
be the next question?
You have
Ah,
any other problem?
Dr. Kumar, what will the next question?
You have any other problem?
Yes. Do you have any other problem?
any
My
other problem?
suggestion is there. Don't jump to this palpitation because you are thinking that, oh, this is a palpitation, there may be heart disease,
So,
right? Because
right.
palpitation is an, what I say, cardinal symptom of the cardiology.
Yeah.
Patient might not have heart disease at all.
Right.
So more
Anxiety.
likely, maybe anxiety.
Yeah.
Why patient is anxious? Patient
Right.
might have warm intolerance.
Right.
So where you go now? To the heart or to the endocrine?
Endocrine.
Endocrine.
This is the
Hyper.
magic. This is the magic,
Ah, so okay, yeah. Good thing.
right? This is the magic.
Yeah.
So don't be as before. Can you tell me more about your palpitation?
No.
Is that
Okay.
traditionally, even I remember when I was preparing decade before, at that time we are doing this thing.
Mm.
But this is evolution. I
Mm.
told you Osce is evoluting.
Evolving.
Evolving rather to say. This is
Yeah.
the evolution. I hope
Right.
you will enjoy it. You will enjoy it.
Sure.
Then you come back to the palpitation, already got, then you could ask a close question. Do you have any the swelling in your neck, or you are looking the patient? Then it will be, especially the female, it may be thyroid disease, not cardiac disease.
Right.
This is the way, and examination will be focused in this way. Okay, but we
Yeah.
created this station actually for the cardiologic issue. Those who practice with us, 65 years, patient is alcoholic. Patient is taking more alcohol nowadays. Okay,
Yeah.
and alcohol
Yeah.
causing paroxysmal atrial fibrillation.
Right.
I will not go in depth of the case. I just open up with you that how to take the data from the very beginning. Then you will reach the diagnosis. And then if patient having the palpitation, patient might have atrial fibrillation relevant outcome also. Patient might have unconsciousness and other. And Mr.
Yeah.
Khatri is a truck driver. So what issue will be important now?
Driving.
Driving means social issue.
Social issue.
Now can you correlate the social issue, how it can take in the lead in the first line?
Yes.
So initial diagnostic formulation and take the social history if relevant, especially minimum ask about what is his job, what is his
Yeah.
occupation,
What he's doing for his living.
what is doing for his living. This is that update. This is the update. And in our future course or whatever, we will follow this thing for the candidates. Remember it. Remember it.
Okay.
So this is the blueprint actually followed by the RCGP. And this is the systems. Okay. But case category as such, acute, chronic, psychosocial, preventive, and many other types.
Okay.
You will read it according to the system checklist. You will read rather. Okay. Nowadays you are switching from the book to the checklist because you have gone through the book in your undergraduate life, postgraduate life. But you need to prepare for the exam, Osce exam. You need to read the checklist, not the book.
Okay.
Understand? Don't mind it. Okay. I am just telling my experience to share with you.
Yeah, thank
Book
you.
already you have gone through enough.
Yeah.
You become already master teacher or senior consultant. How much you will read book again?
Okay.
Now the time to update you by the checklist. And we are doing, we are assuring you, we will provide for you.
Exam oriented.
Yeah, you can check our checklist, some free checklist given in the WhatsApp group already. You can see.
Inshallah.
And it is already updated. It is not like in the last year as before. It is already updated in this. And we are on update regularly according to the need. So in the checklist, if you just assess previous 2024 one-day exam, they have selected this topic. If you can think that it is the GI tract related lab report, fatty liver. Okay, no doubt. Understand?
Yeah.
Another lab report may be from the rubella, infectious disease. You can think of it. But if I tell you the hoarseness of voice, they are not telling about the gastroesophageal reflux. They are telling symptom is hoarseness of voice. If further query tell you that it is an reflux disease as a cause of the hoarseness, you can say this is GI tract related disease, right?
Right.
But if you come across The patient of the hypothyroidism, which system it will be?
Endocrine.
Endocrine. If the patient is a smoker, wasting, losing weight, and having growth in the throat, heavy smoker, could be
Cancer.
cancer of the larynx.
Larynx, yeah.
So which system it belongs to? You can tell ENT or the respirology.
Yes, yes, yes.
For this reason, system-wise reading is not better. Reading means practice, rather to say. I am telling you will read the diseases, hoarseness related many diseases, 5 to 10 diseases. You read it.
Right.
But when you practice, practice as hoarseness of voice, not gastroesophageal reflux disease, not hypothyroid disease.
Okay, okay.
Understand?
Mm.
It will come out later on in your practice according to your history and examination. Then you will be busy with the hypothyroid or carcinoma of larynx.
Oh,
And
yeah, yeah.
this is the blueprint. Okay.
Okay.
So acute chronic psychosocial issue and preventing or lifestyle issue. And we enlarged it a little bit for you, including the child disease as a part of the system, because you will get the proxy disease, proxy case from the child or geriatric. They didn't write, Royal College didn't write about the child disease. For that, we have written it here.
Okay.
But the main target as such, the right panel, we divided into main 7 group. So we are giving the training or orientation according to these 7. In the under the 7, there are some breaking bad news, angry patient and others.
Right.
Legal issue, other issue. Okay. And we develop, actually this thing is a chronic, the data or information collection sheet. I will not detail more. Just have a look quickly, one by one. This is a chronic. This is an chronic like, but we edited it by giving the streak mark. You have to omit this in the history. Okay. Acute emergency situation. You don't need to even focus examination also needed there. Severe chest pain and other, you make an ECG, you got ST elevation. You don't need to go for the examination also. Because ambulance is ready, you shift the patient there.
Right.
Sometime, not all the time. And what is the value of asking, do you smoke on this day?
No.
No need. So opportunistic health promotion, if you ask about the alcohol drinking, you are wasting your time. So this is another strategy, though diagnosis is ischemic heart disease.
Right.
In this way, just look and follow my slide. Psychosocial issue, you need to give extra attention like this. We have to design in this headline diagnosis. Again, modify the checklist or the data form, information sheet. And regarding the consent, like the counseling, you need to follow some additional message, some generic information for the counseling as such. Okay. It is up to date and being updated. Investigation report, how to do it. And the proxy case, baby or dementia patient, senior gentleman. These are some additional message or data you have to collect, the left side. Okay.
Right.
And very fantastic breaking bad news, the spikes mnemonic you need to follow. Spikes is a very popular mnemonic. Spikes. What is the spikes? And anger management, we say technically difficult case management. Another mnemonic very recently discovered, it is called calm set. Calm set. Okay? Calm set.
Right.
So we have shown you up to this calm set, 7 or 8 types of structure, modified structure. We may add few modification in future if possible, but this is our basic. Right side panel is the basic. So you need to practice in these structured case. This is our suggestion. Then you will develop your skill. Okay? Because you have seen that the examiner mark sheet is not system wise, that they are giving the mark according to cardiology or other. They are giving the mark according to the skill, 4 major domain. So you have to avail it. You have to avail it. If no query, no interaction, we're going to end now. Final message for you. Practice, practice, and practice.
Okay. Sure. Okay.
Whatever you have the knowledge, it will not work if you don't have the practice. You have to read many checklists also. And again, remind you these 4 types of skill you need to acquire. And our plan is to sit with you by the mercy of Almighty in future, probably every week, frequently, regularly, to develop the skills with you. Already it is available in the YouTube, but in an updated form. We hope you will join with us. Okay?
Inshallah.
You will join
Inshallah.
with us. And this is our group. I don't know any colleague, new colleague. Sorry, just few seconds for them. I'm giving the Osce WhatsApp group. Somebody might not be in our group. Please join with us. Give me a few seconds to tell you. Sorry, doctor, it is just jumping the one. Don't mind. I'm giving in the chat box for you. Some colleague may not be there. So you can join by one click with us for your updated information. And we like to finish with you up to today's discussion. For the new colleagues, not new colleague, those are appearing in coming Chennai exam or the Colombo. Chennai is very nearer. So we are
Colombo.
inviting you. You can come with us for the practice. We're hoping for the coming week to sit with you in an inaugural session in the coming Sunday. Okay. And
Okay.
very interestingly not, in general, some are in the job, they don't have enough time. Already I had personal talk with someone. The morning, we usually do morning and evening session. So how can we design? Actually, we will decide on the 7th June. It could be in a group or maybe 1:1. We will describe there. Inviting you, those who are appearing in the Chennai or Colombo, you join with us. Practical discussion will happen on that day. And those are very new beginner. You are thinking to appear. Still, I know that some of you are waiting for the result of AKT.
Yes, yes, yes.
And we advise you that after the AKT, you don't need to spend 1 year, 2 year. This is the latest development of eligibility. So you need to prepare your OSCE during your AKT preparation. And it is the high time for you. Okay. And I'm happy that some of you are preparing, even you are waiting for the result. We are praying for
Inshallah.
you. The result should be
Thank you.
positive for you. And then
Thank you.
immediately you join with us with the module anywhere, anytime. You can run it. If you have busy with the job also, anywhere,
Yeah.
anytime. You can read it.
Okay.
Recorded classes are there. Very recently, it was not given before. Checklist you can see in the middle. The
Okay.
50+ checklists are there, and it is being ever growing more and more. Near about 100 checklists we can provide you. And already added the 14 station candidate journey in the last exam. Records are with us. We have given the link there. It was not with the previous module. Our request, those who are using our old module, you just send the message to us. We will give you the updated one. Okay. We will
Okay.
not make a burden for you. We are trying to make a suitable amount or bulk.
Understand.
Understand? We will not add
Yeah.
more and more only additional. We are
You're
modifying
generous.
it. In general, we are modifying it so that it will be lighter for you,
Inshallah.
more resourceful, more meaningful.
Inshallah.
So you can communicate. For this reason, we made this version 7.
7.
Okay. And you can
Okay.
listen. Even the last recall also we added. You know, some of you attended the OSCE recall. There are 3 recall sessions there. Okay. It is
Okay.
already added in the module. So
Mhm.
whatever we get update immediately, we do. And
Mhm.
even in addition, doctor, for you, we minimize the cost also. Okay.
Thank you.
It was not as before this one, but I request that only 2-month option for the immediate examinee. But those who are new, still waiting for the AKT result, better to choose this a longer duration.
Okay.
Okay, longer duration.
Yeah. Okay.
With these few words, I like to thank